Hello and good morning, everyone. Welcome back to Eldercare's training series, Eldercare Academy. I am Adrienne Ostras,
And I'm Lisa Gray.
and we are super excited to have you here with us this morning. Today's topic is going to be pretty different, and I feel like I say that all the time, but this is the first time we're having Sage Health on a training with us, so we're excited to talk about a different kind of topic for
Yes,
agents.
yes.
So it looks like a popular topic. I see a bunch of familiar names jumping on. Good morning, Carolyn. Good morning, Levon, Jeremy, Lynn, Robert, even Steven is
Connie.
on. Connie. Good morning, everyone. As always, we want this to be a conversation. We do these live for a reason to prove that we are real people, very real people that you could be working with and that you can ask questions, right?
Mm-hmm.
You never know what other kind of questions agents might be asking or thinking about. So please find the Q&A box. If you're on Zoom, the chat is disabled. Okay, you have to find the box that says Q&A. Tell us good morning. Tell us the state you're watching from, because we're going to talk about where this is available or where they are available, I guess is the correct way to say that. And if you've ever maybe partnered with someone like Sage before, we would like to know your feedback and where your knowledge is on this topic this morning. And if you're on our private Facebook group, you can simply just comment on the video and we can get those answered. And then if you're watching on the recording, you can comment on the recording, and we are always there to help answer your questions.
We got Texas.
Oh, yeah.
Connie in Texas.
Yeah. And Lynn in Wisconsin. Good morning. Thank you. Awesome. Okay, well, without further ado, let's introduce our special guest. We have Clinton Richardson with Sage Health. Good morning, Clinton.
Good morning. How are you all today?
We are doing good. Thank you so much for jumping on our training this morning to talk to our brokers about Sage Health.
Absolutely. Absolutely. It's my pleasure to be here. I appreciate you all having me here today. And I look forward to educating you all or re-educating some of you about Sage Health and who we are and what we do.
Yes, I mean,
Excited.
yeah, we're excited. It's a good opportunity for agents, right? Like this is what they should be thinking. Like this is a way that, to help grow your business.
Absolutely, absolutely. We do partner with a lot of agents, and I'll be kind of talking about with you all about what we do and how we partner with agents and how we drive success with agents through Sage Health.
Awesome. Thank you so much. Oh, and you got Levon from South Carolina. Good morning. All right, Clinton, you're ready to take it over. I got my pen and paper ready.
All right, all right. I'm gonna go ahead and share my screen here, and you can let me know if you see it there.
Yes.
Yes.
Can you all see my screen? Okay.
Mhm.
So how I want to kind of talk to you all, what I kind of want to talk to you all about this morning is who Sage Health is and what we do and how we drive value through partnership with our agents. So we do work with agents really, really closely. And that's how a bulk of our business, that's how we get a bulk of our business. We have a community outreach specialists that go out into the community and do different events and partner with different places, hospital, senior centers, senior living facilities. And when we do that, we love to bring agents along because again, we're not insurance agents and we don't play them on TV. So we leave that up to the professionals to talk about Medicare and how it benefits our clients and if they have any questions about Medicare. So what I do want to talk about today is driving value through partnership, a value-based primary care model for client success. I am Clinton Richardson. I'm the area sales manager for Arkansas. And we have three locations here in Arkansas, and we're in North Little Rock, Little Rock, and Bryant. We also have centers in Mobile, Alabama. We have three centers in Mobile, Alabama. We have one center in Montgomery, Alabama, a center in Gulfport, Mississippi, and we have three centers in the Baltimore, Maryland area. In the next year and a half, so we will actually be doubling our footprint We don't know what states we're going in yet. I think North Carolina and Florida are on the Florida Panhandle. They're on the list, but I'm not sure of which states we're going to be going in so far. But that's who I am, and that's my contact information below. And if you wanted more information about us after the call, you can go to our website at www.sage.health. Okay.
Awesome. Yeah, agents, be sure you grab his, especially if you're in Arkansas, grab his contact info and what do they need to say when they reach out to you? Like, hey, Clinton, I'm ready to partner with you and
Hey,
get some more
Clinton, I'm ready to partner
clients.
with you. Absolutely. I'm ready to partner
I
with
need
you.
more clients. Get me in front of
Yes,
people.
yes, 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 yes. So before I get into what we do, I wanted you all to have a short kind of story. Meet two patients, same age, same conditions, different with very different outcomes. Patient A, they go to a traditional practice. They're 68 years old. They have diabetes and hypertension. She sees a doctor every 6 months for 10-minute visits. Her A1C is trending up. Nobody called. Year two, she has an ER visit with more diabetes complications, about $28,000 in hospital bills, which is avoidable. And her broker gets a call from her and her family, really, really frustrated. Patient B, they come to Sage Health, same exact condition, diabetes and hypertension. Our physician and our care manager flagged that they have a rising A1C after their wellness visit. She got a call from the doctor. She scheduled an appointment to come in. There were some adjustments in her medications and also some lifestyle changes that the physician recommended for her. We got our nutritionist involved, and they had a conversation. A conversation was scheduled about how she eats, some healthy eating, and some things like that. And 6 months later, her numbers are back in range. No frequent ER visits, no panic call to a broker, and she's living a very happy and healthy lifestyle. In this slide, again, the two two patients exactly the same, but one goes to a traditional primary care physician and one sees a Sage Health physician, which makes the which makes her life amazing. The problem is with fee-for-service medicine, in which we're not, we're value-based care. Fee-for-service medicine is backwards. They're more reactive than proactive. They get paid per visit, not per outcome. The average doctor visit, I don't know about you, but when I go to the doctor for my primary care visit or for a wellness checkup, the doctor comes in, talks to me on his computer for about 5 to 7 minutes, and then he walks out the door. And that's for most Americans. There's no incentive for that doctor to prevent a hospitalization, and he's in and out of that room in 7 minutes because he has about 2,500 patients to visit. I don't know about you, but when I go to the doctor, I would absolutely love to spend more time with my doctor to talk to them about what's really going on, instead of them, having their hand on the door handle as soon as they walk in the room with me, so they can go hurry up and see the next patient. It's more like a churn and burn than real time with your doctor. And with this, nobody gets paid, and with the fee-for-service model, nobody gets paid to keep you out of the hospital. So that's really a broken, that's really a kind of a broken way to look at healthcare. Most people don't look at healthcare as healthcare. They look at it as sick care. Most people only go to the doctor when they're sick. They only go to the doctor when they have a cold or when they're not feeling well. But that's not how our model works. We want to see our patients more often, more frequently, and I'll get into that here in just a second. Any questions so far?
I don't see any yet. No.
Okay, perfect, perfect. Okay, so in value-based care, we flip that model. Again, fee for service, they get paid per visit, regardless of the outcome. They're more about volume and revenue. They're more reactive. They only treat illness. There's little to no follow-up, and the patient navigates that whole system alone. But with us, we're incentivized based on outcomes. I like to say we like to keep our patients happy, healthy, and out of the hospital because in value-based care and especially in our model, the ER urgent care is not our friend, are not our friends. Why do I say that? Because we're full risk. So if anything happens to our patient, if they have to have an ER visit or if they get hospitalized, then we actually take on that risk or take on um, what's going on with that patient. And if they do have bills and things like that, we're responsible for that. So again, we don't like our patients going to the ER. We don't like them going to the urgent care. We want them to come see us. Quality plus prevention equals for us revenue. Again, we are incentivized to keep our patients out of the hospital. So the better we have to give our patients more quality care. And we're looking for things that may happen. One of my counterparts in Mobile, he likes to say that we're like LifeLock for your health. We monitor any potential threat that could happen. Now, will it happen? We hope not. But in the event that it does, we are there. We're trying to catch that before anything thing does happen or before it gets bigger. We're more proactive to prevent illnesses. A lot of people say, well, I don't need to go to the doctor. I feel fine. Well, that's when you need to go to the doctor, when you feel fine, so that you don't feel bad. And that's why we see our patients more often. A typical visit with our doctors is about 90 minutes long. So for that first 90-minute visit, at least 60 minutes of that is spent with the doctor talking about, your health, talking about your conditions, going over your medications, making sure there's nothing that's duplicated so that we can make sure that again you are the best version of yourself. I don't know about you, but my grandmother passed away a few years ago from a preventable illness. And if something was like Sage Health was around then, I think and I wholeheartedly believe that if they would have caught that in the beginning, then she could have been around today. So that's why I'm really passionate about what we do, especially for the senior community. Continuous care between visits. Um, Depending on the severity of the condition that the patient is going through, the doctor may want to see them every 4 weeks, every 6 weeks, every 8 weeks. And again, that's to make sure that nothing is progressing or to make sure that we stop any potential threats from happening in their health. And we also have a dedicated care team. We have a whole slew of folks that are involved in the patient's care. So when you send your client or send your patient to Sage Health, it's not only the doctor. We have a care coordinator which actually helps them navigate some of those Medicare benefits because we know that you're busy and you don't have time to take every single call from every single client that you sign up. That's when we step in. We say, "Hey, Miss Smith, we see you have this Humana plan here. Here are some of the benefits that you have with that. Let us help you take advantage of all of those. And if they have any questions that we can't answer, we always send them back to the client or sorry, to the agent that sent them to us. We are all about protecting your book of business. We're not going to send them to Joe Blow agent on the street to steal your book. We want to make sure that we're protecting your book of business as well. Okay. Um, any questions? Anything? Nope, we're good.
Not
All right,
yet.
perfect. Perfect. All right. Okay. What Sage Health looks like in practice. Our clients get more time with the provider, longer visits. They have real conversation and a care team that catches problems. Again, we have a dedicated care team. Something that's really unique about us is that our physicians only have a maximum of 400 patients per client. Most fee-for-service physicians have about 2,500 patients per client, again, which is why they churn and burn. They're only able to come in the room and see you for about 5 and 10 minutes, and then they go ahead to the next patient. Same day access. So there's no 6 week wait times. If our patient is having a medical emergency or they feel like they need to come to the doctor that day, we do have either same day or next day sick appointments. But if there's something where they absolutely need to go to the ER, our physician will send them there, and they actually also have 24/7 access to a physician. So which is really unique about us as well. We provide transportation to and from those primary care visits, and we'll coordinate transportation to any specialist visits that they may have. Gap
Huh?
and care outreach. So again, we'll see them more often, more frequently to either stop something that's going on or prevent something from happening for them. And we also have social services in the clinic as well. So we do have a licensed social worker that can help with any social determinants of health. They help with housing, they help with bills, they help with a whole slew of things that we did. They also help with some food insecurity. Security. Some and most of our clinics are placed in more underserved areas. So there's a lot of folks that we see that they're not used to going to the doctor. They don't realize the importance of going to the doctor. So our social workers there to help them with that. And we also do a lot of fun things in the clinic. We have an activity room that's about 3,000 square feet in each clinic where we play bingo, chair yoga, they do Tai Chi, a whole
Wow.
lot of fun stuff in there. During the Derby, they were having pony races. They had the little stick ponies, and we had the seniors
I
going
love
around
it.
doing races. So it's a lot of fun things that we do in the clinic as well. Because that's a social aspect, we have a in our clinic in Bryant, we had 3 or 4 patients that didn't know each other. But they started coming to bingo together, and most of them, all three of them, were either widowed or that they just didn't have any family around. But by coming to the clinics and really taking a part of some of the events, they really got involved with one another. I call them 80 for Brady because they do everything for each other with each other now. They go to the movies, they go to football games, they do all kind of stuff together. So they
I love
develop
that so
friendships and
much.
things like that too. So yeah, that's really fun. That's really cool too.
Is
So,
that like the same room where like agents could host educational
absolutely,
seminars?
that's the same room where agents can host their educational events, and that is something that we really are partnered with agents with as well. In our activity centers in each one of our clinics, that it's open to you all to do whatever you want to do. If you wanted to host a Medicare 101, if you wanted to do T65s, or if you just wanted to come in and say, "Hey, Clint, I want to come in and call bingo," or one of my outreach specialists can call you and say, "Hey, do you mind calling bingo with the seniors today?" That's an opportunity for you to get in front of clients as well, not only to try to sell them things, but for you to have a relationship with them so that when those questions do arise and they don't have an agent, they can say, "Hey, Clinton, I talked to Sam over at your clinic a couple of weeks ago when he was calling bingo. He mentioned if I had any questions, I can reach out. I like to give him a call." So those are the relationships that you all can build as well in the clinic, which I think is really, really cool. Okay. What makes us different? What makes Sage Health different? So we're a senior first full stop shop. Every staff member is trained for patients 55 and older, and that's something that's unique about us. We do not accept patients if they're under 55. Our specialty is 55 and older, so they don't have to worry about 18-year-olds or 20-year-olds or anything like that being in there or taking up the time from those from the seniors. We believe that seniors, have they've lived a life and they've lived a full life, and they deserve the type of care that we offer. Every process that we have is built around the senior needs. Every clinic space that we have is built around comfort and mobility. Our clinics are about 10,000 square feet, and we are built for growth. We can accommodate about 1,200 when we're when we have a full panel of patients for every physician. We can hold about 4 physicians or 4 providers in each clinic, each having about 400 patients. So that's about 1,200 patients in each clinic. We don't do pediatrics and no urgent care walk-ins for folks under 55. And again, our max patient panel is 400 per physician. And again, the typical is about 2,500 for physicians. And you may be asking, well, Clint, how does this help me? Retention, referrals, and reputation. Better reputation. Healthy members stay enrolled longer and they have fewer October disenrollments. If we have someone that we're taking care of, and we've seen this time and time again, and they adhere to what we're doing, they're getting healthy, they're getting the help that they need. They stay enrolled in the plan unless, of course, again, something happens or something changes or a plan just does a crazy degradation or something like that, and you have fewer disenrollments. So, and people won't, and we always tell our clients during AEP and during OEP, if Jimmy Walker or Joe Namath tries to call and sell you a health plan, do not answer those calls. Um, Talk to your agent because they know what's going on, and they have the best information about you, and they know the plan that you're supposed to be on. A referral engine. Happy patients tell the neighbors, and your name is the only one that they'll share. If you refer someone or you send someone over to Sage Health and they're getting the care that they need, they're going to tell somebody about it. They're going to say, "Hey, my client, my agent hooked me up with Sage Health, and I absolutely love it. You should call him." And then what you and what we want you all to do is call us so that again it's just a full circle thing. Stronger reputation. You place them in a model that improved their life, so they really trust you. And this is about real partnership. We want to co-host events with you. We do have a program. It's called the Broker Education Program, and that's for local brokers. If you want more information about that, again, I'll share. You can give me a call or send me an email, and I can send you some information about our broker education program. And we grow together. And I said this is Arkansas, but in Arkansas, Mississippi, Alabama, and Maryland. So. And some of the health plans that we accept, and again, this is just in my Arkansas market. There are some other plans that we accept in the other states that we're in. But here in Arkansas, we're partnered with Aetna, Humana, Devoted, Health Springs, WellCare, all well. And something that's unique about us is we also accept Medicare. Now, with accepting Medicare, we actually accept supplements from every single plan, even if it's a plan on here that we're not partnered with. Right now, we're not partnered
Awesome.
with an Arkansas United Healthcare or Blue Cross Blue Shield, but we accept supplements from every single plan out there because if a patient's on Medicare, we cannot not see them, even if it's a supplement. So that's something that I
Right.
definitely want to point out there. All right. And I schedule a tour with one of my community outreach specialists. I have three outreach specialists in North Little Rock, three in Little Rock, and one in Bryant. Most of our clinics have at least 2 to 3 outreach specialists that are out in the community that are doing events that are out there meeting seniors. So that's an opportunity. And every single event that they go to out in the community or that they have in the clinic, they have to have a broker with them, have an agent with them, because if any questions or anything, like I mentioned before, if any questions come up about Medicare, about plans or things like that, we want a professional to be able to answer that and not just shooting in the dark, trying to come up with an answer for them. And these are my locations here in Arkansas. So in North Little Rock, 6929 JFK. In Little Rock, we're at 410 South University. And in Bryant, we're at 1800 North Reynolds Road. And all of our centers are situated in areas like in Arkansas, for example, we're right there between Kroger and the 10 Fitness. In Bryant, we're right across the street from the 10 Fitness. In Little Rock, we're in a Target shopping center. So we try to make sure that we're in high traffic areas that are easily accessed by that can be easily accessed by our patients. All
And
right.
near pharmacies, it sounds like.
And if absolutely, and pharmacies as well. Absolutely, absolutely, absolutely. So that's all I have for you all today. I told you I wouldn't be very long.
Yeah, no, that
But
was perfect. That was
but I definitely again appreciate the opportunity to come and speak before you and your agents. We are excited about the partnership with Eldercare, and I believe that with the just with the right training and with the right information, we can definitely help each other grow in this space. So yeah,
I agree. I completely agree. And thank you so much again for taking the time. And thank you, agents. We do have a few questions coming
sure.
through. So Jeremy had asked if there are any plans to expand. I think that's the only unfortunate part, Clinton, is that you're not in enough areas.
Yeah, yeah,
But he's
yeah.
wondering if there's any plans to expand to Conway or Russellville.
So we are actively in my operations team, and they actually just left, and I spoke with our VP of operations. We're actually looking in areas where we can expand. So I'm not sure if Conway and Russellville they're on the list. I know Northwest Arkansas is a possibility. Um, but I will keep you all posted when I know, I'll definitely tell you all. How about that?
Awesome. Yes. As soon as you know, we need to
Yeah.
spread the word. We
And
do
and
have
something I mentioned that we offer transportation, so I kind of wanted to give you all a picture of what that looks like. So anything within a 30-mile radius of each one of our clinics, we offer ta transportation to and from those clinics. So, we do
that's
have
not
patients.
using their benefits. That's
That's
just
not no for the primary care. No, for primary care, that's us. We use that's all on Sage Health. That's something that we offer to our clients. Now, if it's a specialty or a specialist visit, we will utilize that benefit if they have it. But if not, then we will because we don't want our patients not seeing a specialist if they have to. So
right.
we'll make sure that they're able to do that as well. So yeah. So we do have patients that live outside of our clinic area in Arkansas. For instance, I do have patients in Mayflower. We have patients in Lone Oak, and they come we provide them transportation to the North Little Rock Clinic, and I have patients
Oh,
in like
wow.
in Bryan, Malvern and Sheridan, and we offer them transportation to the Bryan Clinic. We go a little bit further out there, and I have a few patients in the village, in Hot Springs Village. So yeah,
That's good to know.
Nice.
Very
yeah,
good to know.
yeah.
And then Stephen had asked, which I don't know if this is finalized or anything yet, but there is a new Medicare Advantage carrier coming to Arkansas. It's Healthy Arkansas.
Healthy Arkansas, yes, yes.
Do
So
you
so
know if you'll be a network for them?
So we are, and I actually met with their broker manager. So we are in conversations with Healthy Arkansas to be in network with them. So yes,
Great question, Stephen.
yes,
Yeah.
absolutely. Yes,
That's
yes,
we
yes,
like good news. And so
yes.
like I was just curious, just like as a personal question with Sage Health. So like I mean, it sounds like you have a lot of different kind of departments in Sage Health. So
Hmm.
you have doctors, you have
Hmm.
um care coordinators, you have
Hmm.
nutritionists, you have
Hmm.
community outreach.
Hmm.
Like, is there anything else I'm missing? Like,
So absolutely. So we also offer cardiology because we find in a lot of seniors heart health is I mean the leading factor to just their overall unhealthiness.
yeah,
So we offer cardiology. So we have Ecotech that's
okay,
in our centers that do that they'll do echo, and that's a screener that we do on every single patient that we have.
wow,
Um, and with that being said, we've actually had patients that have had the echoes done. We found problems and prevented them. One, we actually found where they had a blockage and they had to have surgery that next day, and it pretty much saved their lives. So
wow.
we have that. I mentioned social work, so we do
Oh
that
yeah,
as well.
social work.
We
Okay.
do social work as well. Yeah, so that's about it. We actually have our on-site lab in the clinic as well, so that we know a lot of patients don't go to the lab if it's an appointment outside of their primary care appointment. So we try to make it so that they don't have to go to five,
Mm,
6 different appointments. So we'll actually do those labs in the clinic for them, and the doctor or our nurse case manager or nurse practitioner will go over those labs with them. Something I also didn't mention is we offer, if we have a patient that becomes where they can't come to the clinic, we'll actually do in-home visits with them so they don't have to come to the
oh,
clinic. So that's something that we offer as well.
wow.
That's a plus.
Yeah, it
Yeah.
is. It
That's
is.
a
It's
big that's a
yeah.
big plus.
Yeah, it's really concierge. If you remember, if I grew up watching Andy Griffith with my grandparents and my parents, and the doctor that came to the house with a black bag if you were sick. it's almost like that black bag service. If something's going on, we want to make sure that we give that to you.
I love that. I love that a
Yeah,
lot.
Amazing.
It is
Yeah.
really amazing. I hope agents, this has inspired you to kind of partner with Sage Health and getting in front of more clients and maybe hosting some events and just working with them to get in front of people.
Right.
That's up to you, right? It's your
yes,
responsibility to get in front of as many people as possible. And Sage Health is here to help you do that. And
absolutely.
if Sage Health isn't in your area, because I know we're talking to agents from all over the US, there are other value-based care
There are.
opportunities out there. So if you need help doing that research and finding one, or just Google it,
Yeah.
is what I would say,
Right.
and
Mhm.
find yourself an opportunity like this, and just keep your fingers crossed. Sage Health eventually makes it your way.
Right.
Absolutely.
Hey, I'm gonna ask one more question. As far as educational events, Lisa's like she's gone rogue. um, I know you mentioned like educational, like Medicare events, but
Hmm.
would Sage Health like let agents do like life insurance educational events too?
Yeah, yeah, absolutely. So my only thing is you can get we allow them to offer the information, but if they
Mhm.
want to talk as far as pricing and things like that, just set up a private appointment with them. But yeah,
Right. Yeah.
anything that can benefit our clients, we 100% offer. We do again nutrition classes. We've talked about we've had end of life care. They come in talk about hospice.
Mhm.
They come in talk about. I mean, there's a plethora of things that we allow to go
Cool.
on in the center as far as education wise, because we know ultimately it's going to help them make better decisions around their health. So yeah,
Exactly. Yeah.
Yep.
All right.
Oh,
Well,
preventative care is the best medicine.
it 100%.
Yeah.
They say an apple a day keeps the doctor away. We
That's
believe
right.
keeping your appointments keeps sickness away. So yeah,
Keep in check.
yeah,
absolutely. There
absolutely.
is there. I see someone has their hand raised in
Oh,
Zoom.
Um, I'm not sure what that means, but we
Okay.
don't. But thanks, Carolyn. We see you
Okay.
waving.
Okay.
Alrighty. Well, I hope you all have a great rest of your day, and we
thank
look.
you for joining.
Yes, thank you so much. Bye,
Thank you
We
everyone.
all so
enjoyed
much. I
it.
appreciate it. Thank you. Bye bye.